How do psychological factors impact urination? Imagine your brain and bladder are like a team working together to keep you comfortable and dry. When everything is functioning smoothly, your bladder fills, signals are sent to your brain, and you feel the urge to go at the right time. The brain then tells the bladder muscles to contract and the sphincter muscles to relax, letting urine flow out. This process, called micturition, is a complex coordination of nerves, muscles, and brain signals. But your mental state can influence this delicate system. Stress, anxiety, and depression are psychological factors that can significantly affect how you urinate. When you're stressed or anxious, your body releases chemicals like cortisol and other stress hormones. These chemicals can cause changes in your nervous system and in the muscles of your bladder. For example, stress can make the bladder muscle, called the detrusor, overactive or hypersensitive, leading to symptoms like urgency or frequent urination. Research shows that chronic stress can also trigger inflammation in the body. This inflammation can affect the nervous pathways that control bladder function, making symptoms worse. In animal studies, prolonged stress has been shown to cause changes in urinary behavior, supporting the idea that mental health directly impacts bladder health. Depression is another psychological factor linked to urinary issues. It can alter neurotransmitter levels, such as serotonin, which play a role in both mood and bladder control. When serotonin levels are off balance, it can lead to problems like urinary incontinence, especially in women. Additionally, depression often increases activity in the sympathetic nervous system, which raises stress hormones like cortisol. Elevated cortisol can interfere with normal bladder function, making symptoms more pronounced. On the flip side, having urinary symptoms can also cause psychological distress. Feeling urgent or incontinent can lead to embarrassment, anxiety, or a reduced quality of life. This bidirectional relationship means that mental health and bladder health are closely connected. Managing stress and mental health can sometimes help improve urinary symptoms, alongside medical treatments. It's important to remember that while psychological factors can influence urination, they are not the root cause of conditions like bladder cancer. However, chronic stress and inflammation are areas of ongoing research for their potential roles in overall health. Maintaining good mental health is a vital part of overall well-being, including bladder health. If you experience persistent urinary symptoms, it's essential to see a healthcare professional. They can evaluate whether psychological factors are contributing and recommend appropriate treatments, which may include stress management techniques, counseling, or medical interventions. Always seek personalized advice because each person's situation is unique. In summary, psychological factors like stress, anxiety, and depression can impact urination by affecting nervous system signals, increasing inflammation, and disrupting the normal coordination between the brain and bladder. Addressing mental health alongside physical symptoms can lead to better bladder health and overall well-being. Remember, taking care of your mind is an important step toward a healthier bladder.